Hi, it's Ileana here today. So, I wanted to talk about some interesting health topics today. Primarily, I wanted to talk about migraines and light sensitivity and sense sensitivity. Sensitivity to smells, as well as to food. Um, when I became an alternative medicine practitioner, the reason why I began studying alternative medicine is because about 4 years ago, I was diagnosed with having hemiplegic migraines with paralysis. And I also have light sensitivity and smell sensitivity. So I had to totally change the way I live, basically, because I also have autoimmune issues. I have Hashimoto's thyroiditis. So this made it was basically a wake up call to change my lifestyle. I changed up my foods because when I would eat gluten, wheat, or grain, I would get an awful migraine. I would start feeling fuzzy brained or fog brained, like I couldn't remember anything. I would become dizzy, tired, fatigued. And I basically had to lie down and rest. And I figured out, well, if I cut out certain foods from my diet, that would go away, like the headache or migraine, the paralysis, the tiredness, the fatigue, the dizziness. So I removed first gluten, so I wouldn't get celiac disease, because when you eat gluten or grain or wheat, you might get celiac. I was tested for that, but since I was off gluten already, I didn't have celiac disease. But because I have Hashimoto's thyroiditis, it's basically when the thyroid doesn't produce enough hormones. So you have to take replacement hormones. I was extremely allergic to the syntheroid. It made me really sick, and I couldn't swallow it digestively. I felt like my digestive tract was being ripped apart, so I couldn't swallow it. So I went on desiccated thyroid, which is made out of it's made out of porcine hormones, pig hormones, and it's natural. So that's keeping my thyroid basically from eating the rest of my body. And yeah, because what happens when you have thyroid issues, I'm hypothyroid, so I don't get enough thyroid hormones. It basically, the thyroid attacks the rest of your body and eats up other resources, and that's unfortunate. It's an autoimmune disorder. So I figured that out, and I thought I'd figured out the migraine issues. But the thing is, like, I tried all kinds of medications. I tried calcium blockers like flanazine, Sibelium. I tried Topamax. I even tried Ativan, lorazepam. Those are anti-anxiety drugs, but I don't have anxiety issues, so they didn't work for me. They just made me hyper. My body cannot take in any medication that is pharmaceutical grade. It's just synthetic. It's all synthetic, and my body just rejects all of it and doesn't help with the migraines. In fact, it makes it worse. And when I was on Topamax, I would actually experience more numbness and more paralysis, which I already have symptoms of. So, I immediately stopped taking that medication. Sometimes there are people that medication just doesn't help. I'm not saying don't take it. If you're suffering from migraines and you need to try something, try it if you must. But for me, none of that stuff worked. So what I did try is, because I have light sensitivity to fluorescent lighting and also to LED lighting. What I did was I removed many of the lights that were above my head because they do emit electromagnetic field energies, frequencies. So when you're sitting under these bright lights directly, when they're above your head, it's really painful and uncomfortable. Some people immediately get a migraine and aura symptoms like temporary blindness in their eyes, foggy brain, you can't think, you can't concentrate, you can't remember anything. They become dizzy. Some people become nauseous and they throw up. Others get paralysis or numbness. So those are side effects of having a migraine or having a hemiplegic migraine. There's also ocular migraines, tension headaches, all kinds of different headaches and migraines. There's more than one. So it did help after I got the lights removed above my head at home and at work. But the thing is, eventually these migraines became chronic as of recently. And I also have a combination of a tension headache with a migraine, which just makes it very hard to concentrate and remember anything. And judgment is just almost out the window. So, I've had to stop wearing my tinted glasses. I have tinted glasses that are a green, grayish tint shade on the lenses. They just feel too heavy. It's a metal frame, so it feels too heavy on my the bridge of my nose and in the back of my ears. It's so painful because of the combination of tension, headache, and migraine. I've had to stop wearing those glasses. So the search is on right now to find a light pair of tinted glasses that would work for me and not exacerbate the migraine/tension headache. The thing is, it's very important, like if you are triggered by bright lights, some people are just triggered, period, by bright lights. Doesn't matter if it's fluorescence or LEDs, or other source of lighting. Some people are just triggered, period, by bright lights. And there's too much of them around you. It could trigger your eyes and it could trigger your brain. There is something called light leakage. It goes through your eyes into your brain and your blood vessels constrict and it's painful. That's what triggers the migraines or the headache. So, there are options if you can't take medication. There is alternative medicine. There are herbal supplements that you can try that does, help to control and treat the migraines. Like there's feverfew, herb. You can take in a tea. There's willow bark. It really helps with migraines and headaches. There's also medical grade marijuana that also works for some people with migraines. So there are options to try other than the pharmaceutical medications. And if you're really sensitive to bright lights, try tinted glasses or tinted contact lenses. There's also various grades of lenses for glasses. Like for me, I've tried wearing glasses that have plastic lenses, but my eyes seem to go cross-eyed and I can't concentrate or focus in the middle of the vision, head-on vision where I should. So I might need actually glass lenses in the glasses, but something of a not so heavy, dense material in terms of glass. So there's various degrees of lens quality for glasses as well. So I'm going to see a trauma optometrist who deals with vision issues and, learning disabilities and stuff like that, to see, like, and you have to explain the issue correctly as well, what's going on with you. Just explain it how it is. Don't leave out important facts in what you're experiencing with these symptoms of migraines and light sensitivity and sensitivity to sense. If you're seeing a specialist, please tell them the whole story, because they need to know what's going on. And in terms of the sense sensitivity, I am like almost sensitive to, I'm very sensitive to perfumes, detergents. Most detergents like Gain and Tide have a lot of chemicals in them that could cause neurotoxicity, chemical neurotoxicity to go into your body and your brain. And it takes a long time to detox that out of your system. And it can trigger headaches, migraines, sneezing, wheezing, coughing, choking. So breathing issues, stuffy nose, runny eyes. So, almost anything can trigger you in terms of sense. And it's not really an allergy, it's a sensitivity to smells and scents. I have a hard time with detergents that have a distinct smell. So I use non-scented detergents. I use non-scented deodorants for myself. There is a way to minimize the sensitivity issues to smells and scents. If you're allergic to some food, that makes you nauseous, or you can't tolerate the smell, just don't eat it. If you have a sensitivity to a detergent or a perfume or something else, it could be lotion, it could be hand products, it could be skin products, it could be makeup as well, because some makeup does have a scent to it. It could be just body wash, it could be toothpaste, it could be anything basically these days. So if you feel like you have a problem with it, just don't wear it, don't eat it. And if there's somebody else around you that's wearing perfume or a detergent or something, deodorant, on their clothing that you're very sensitive to and it triggers you the wrong way, please ask them to stop wearing it. Ask them kindly and gently in a nice manner, not to agitate them, or don't make it seem like you're provoking them. Just try to ask in a diplomatic way if they'd be willing to switch to a non-scented detergent, or to please not wear perfume around you, because it causes you to have a headache, a migraine, or breathing problems. And do explain what the issue is so they understand what's going on with you, that this is really almost harming you, but in a diplomatic way to explain it without causing, any misunderstandings. And, people who work in public services around others, or in stores, in any public place, this could be more of a trigger because there's smells and lights everywhere. So you kind of have to be very diplomatic in how you approach the situation as well, if you have any of these issues. And in terms of food as well, I, because of the migraines, I stopped eating chocolate. I don't drink alcohol. And it has, I don't even drink coffee, and it has helped to decrease some of the migraine attacks. And sometimes a migraine or a tension headache could be triggered by cold weather as well, or a change in the weather. If it's too hot, you can be triggered. If it's too cold, you could be triggered. So it's environmental surroundings as well that can be a factor, not just food and light. So It's important to be aware of what triggers your symptoms of migraines or light sensitivity or smell sensitivity to scents and stuff. So just look around you what you're using, and if it's causing you issues, switch it out for something that's non-scented. In terms of products, look at your food. Look at that, because that's important. And remove anything from your diet that triggers you and see what happens. If it helps, great. If not, look at it more closely to figure out the triggers. And, doctors, sometimes they can help you, sometimes they can't, but it's good to have it all on file, what your medical history is. And, for people who are triggered by scents, carry an epinephrine pen, because it basically could save your life so you don't have an anaphylactic shock. An epinephrine pen is just adrenaline, basically. You use the pen and it just helps you to breathe better. Carry an epinephrine pen, because smells and scents, if you get overstimulated by something, it can start closing up your airways and make it very hard for you to breathe. You feel like you have chest pain and you're choking and you're wheezing and coughing. Use the epinephrine pen. It doesn't have much in it, just adrenaline. And it should stop the anaphylactic shock. If you need it, use it. So, look into it, do some research. What's going on with you? And there is hope. There is always hope. I mean, if you can't take the pharmaceutical medications, try tinted lenses. If you have light sensitivity, try them in glasses. Try contact lenses if you can. They do make contact lenses that have tints in it, and it could take some time to find the appropriate tint color that would work for your eyes. Get tested. Wearing tinted glasses has helped me tremendously, and I'll be looking for other tinted glasses that are lighter in frame, that aren't metal anymore. I still suspect I need lenses for my glasses that are made from glass. And it also, there's different types of prisms that are put in lenses for glasses, and even contact lenses. So, it's really about exploring your options and seeing what works for you. Try alternative medication, alternative medicine, herbs, supplements, flower extracts, essential oils. Explore all your options. Keep an open mind. Don't close up and like, oh my God, these symptoms aren't going away. I feel sick all the time. Actually try to figure out your triggers, what's causing it. And it can be very scary. It could be very scary. So, if you need to, go see somebody. A psychologist, an alternative medicine practitioner, somebody who'll listen to you and will understand what's going on with you. Because, it is good to talk to somebody about this so you don't feel like you're all alone. Or even join a support group. Sometimes people in support groups for migraines or light sensitivity, they've tried things and that have helped them, so they could have some insights in what can help you. Do some research on the internet as well about these conditions or symptoms, because if you know what's going on with yourself, it helps to alleviate the stress factor. Being scared is no way to live. If you know what's going on to you, you have the knowledge, you have the information to help yourself. And most of all, don't give up. Don't give up on yourself. look for ways to help yourself and to not feel like a victim. I know it may seem very hard and it may seem impossible, but nothing is impossible. I'm learning that, and I'm going through this right now. I have a tension headache and a migraine every day. I've had it since October, mid-October, and it's not fun. I sometimes I felt very helpless, and and it's not just me. I'm asking others, can you please not use this perfume? Can you please not use this detergent because it's causing me this and that? And at home, what I have is incandescent lighting that really, if you can get your hands on any incandescent lights, and if you don't have a problem with it, if you're not triggered by them for migraines, use them. I know they're becoming a rarity, but incandescent lights are not so bright, and the electromagnetic frequencies, they emit less of these frequencies, so they're more old-fashioned technology, but they're pretty good for migraineurs. I mean, I have incandescent lights all over my house, and it saves me. And also have a dimmer switch so you can control the amount of lighting you're getting if you have migraines and stuff. So dimmer switches are fabulous. I highly recommend them because you can lower the amount and frequency of the brightness of light that you're getting. If you need something lower lighted, fine. If you need more light for like a few minutes or an hour, you can adjust your lighting. You have the control of how bright you want your lights to be. Also, adjust your monitor. Your computer monitor, the brightness of it, the contrast. Your cell phone, you can adjust the brightness and contrast on that as well, because sometimes the brighter your monitor is, the worse it makes your headache or migraine. Again, it's being triggered by light sensitivity. So, there are ways of figuring out what would make you comfortable and what doesn't. And in the winter, try to stay warm. So don't let the cold get to you, because that can trigger migraines or headaches. Wear warm clothing. Make sure the heat is up in your house so you're warm, so your vascular blood vessels don't constrict in the brain, so you don't feel that pain factor so much. Just figure out how to manage those triggers. And if you need to take time out, if you can, from work, do it. Time does heal all wounds, and I believe that. So if you can take that break, do take it to figure out what you can do for yourself to help yourself to manage the migraines, manage the scent issues, manage the light sensitivity, manage the headaches. Where there's a will, there's a way. It's just about figuring it out and seeing what works for you and what doesn't. So I just wanted to share that information, what has helped me and what I've done to help myself. It may not seem much, but it can make a difference. Just changing your diet. I no longer eat any foods that are GMO or have MSG in it, that have sulfates, too much salt, too much sugar. Even sugar, refined sugar, can trigger you because it has bleach in it. So, look into your food stuff. Look into your detergents, into your perfumes. Some people are even triggered. They have a migraine or a headache just by using essential oils or working with herbs. So look at what you're using and try to remove what triggers you. And I tried medical marijuana and it didn't work for me. It actually caused me to have more of a migraine and paralysis. But I tried it. I kept an open mind and I tried it because I really wanted to help myself to not have these migraines anymore. So just try to see what would work for you and keep on trying until you figure it out. So, because there's no easy fix, there's no quick, easy fix for getting rid of migraines. It's Doctors don't really know yet what causes the migraines and why electrical signals get mixed up in the brain. You know, they're doing research into it, but they don't really know the real cause of this stuff, and they don't have an easy quick fix. They can give you medication to stop the triggers, right? But you can't sit on that medication forever. After 6 months, you gotta stop taking it, because these medications don't come without a price, like the flanazine, the Sibelium, the Topamax. After a while, they can ruin your liver and your kidneys and other organs in your body. You can't sit on these medications for life. You can't just keep on taking them. They're a band-aid. They're just a quick fix. Eventually you have to come off of them. So, you know, doctors have not yet created a magic pill that just actually fixes the migraine without any negative side effects. The medications, most of them do have side effects. So that's something to think about as well. When, if you're thinking about going on this medication, think about what you're taking and why you're taking it. I hope one day they do find a cure for this, all of it, and without any side effects. But who knows when that will happen. So for now, look at everything in a big picture and figure out what works for you and what doesn't, and try to help yourself as best you can. Thank you, and namaste.